Hello, let's talk about local anesthesia of the maxillary arch, including palatal anesthesia. Let's first review the nerves. You've got the trigeminal nerve, the maxillary branch, and then the superior alveolar nerve comes off of the maxillary branch of the trigeminal nerve. You can see how the superior alveolar nerve goes to all the teeth and to the palate. So when I'm giving local anesthesia, these are the nerves I'm wanting to anesthetize. And I'm going to do that with a 30 gauge short needle and sitness plane. And then I'm going to also use a 27 gauge long needle with lidocaine. And when I use the long needle, I'm placing it all the way into the tissue to the hub of the needle up in this area right here, and that will block all the branches of the superior alveolar nerve. So first we're going to apply topical anesthesia, and this is lidocaine, prilocaine, and tetracaine compounded, and you leave that on the soft tissue for about a minute. Then I'm going to spray that with hurricane, which is 20% benzocaine oral anesthetic, and I'm going to spray that on there. And then I'm going to blow that into the tissue with my air syringe, and that's going to penetrate probably a millimeter. Then I'm going to come back with a 30 gauge short needle and bend the needle toward the bevel. Now if you've watched my anesthesia videos giving mandibular anesthetic, I'm going to bend the needle toward the tip of the needle because the needle is going to travel toward the tip. When you're giving infiltration anesthesia though, the needle is not really in the soft tissue so that it travels. It's going to hug the bone, so you want the bevel toward the bone. So I'm going to bend the needle when I'm giving maxillary anesthesia, infiltration anesthesia, toward the bone, and just barely go under the tissue and tap the end of the needle, and that will place some of the sitness plane, which is pH neutral, in that tissue. And then as you move the needle into the tissue, keep tapping the end of the syringe, and it'll keep that sitness plane, which as I said was pH neutral, ahead of the tip of the needle, and the patient won't feel anything. So go ahead and place it all the way up the entire length of the needle, but start with just barely placing it under the tissue and tapping the end, creating a little bolus of the local anesthesia, and then you can slowly move the needle further into that soft tissue, hugging the bone with the bevel of the needle against the bone, initially numb the soft tissue. Then we're going to come back with lidocaine 1 to 100,000 epinephrine. Place that in the areas that we've already anesthetized the tissue with the sitness plane. So the sitness plane is not going to be very long-lived. It's only going to last probably 30 minutes or so. The lidocaine 1 to 100,000 is going to last a couple of hours in the maxilla and probably 3 or 4 hours or more in the mandible. If I want a longer lasting anesthesia, I'm going to use Marcaine. So this is still the sitness plane, anesthetizing the soft tissue, and then I'm going to come back with the lidocaine in the same area that I've anesthetized with the sitness. The sitness is only to anesthetize the tissue because it's pH neutral, so it doesn't sting. The lidocaine is more profound, and so once I've anesthetized the soft tissue, I'm going to come back with the lidocaine or the Marcaine because it's more profound. Starting with the 30 gauge short needle, and here's the bevel on this side. I'm going to bend the needle just a little bit that way, only in the maxilla. In the mandible, I'm going to bend it the other way because in soft tissue, I'll show you here in a minute with this long 27 gauge long, the needle's going to move toward the tip of the needle. Then once I've anesthetized with the sitness plane with the short needle, I'm going to come back with the 27 gauge long. In the I'm going to bend the tip of that needle also toward the bevel. Now only bend the needle toward the bevel in the maxilla when I'm giving infiltration. And I'm going to use this long needle to anesthetize adjacent to the second molar. And when I anesthetize, I'm going to anesthetize the superior branch of the superior alveolar nerve. So I'm only using that in this area, and I'm going to place it all the way in right there in the area of the second molar. Now this is the 27 gauge long needle, and I've bent the needle just a little bit toward the bevel, and I'm going to slide that in the second molar area so that it's hugging the bone, and slide it in the full length of the needle, and you'll anesthetize the superior alveolar nerve. This is the lidocaine. You're going to anesthetize right up here. You're going to anesthetize the entire superior alveolar nerve. When you do that, you're going to come back and reinforce with infiltration in these other areas. Now, when you're anesthetizing the palate, you're going to work your way toward the incisive foramen and the nasopalatine nerve, the greater palatine foramen, and the anterior palatine nerves. Now, if you want a patient to hate you and have a fear of dentists all their life, go straight here and straight here. I'm going to show you how to get to those areas without going straight to them. We're going to move through the papilla, and we're going to place topical anesthesia and use pressure anesthesia back here. Let me show you how that's done. Remember, I've already infiltrated in the vestibule on the facial with the sit-nest plane and the lidocaine 1 to 100,000 epinephrine. Now, once this tissue is numb, I'm going to use my 30 gauge short and the sit-nest plane and place it on the facial part of the ridge, and just put some pressure on that so that this local anesthesia moves through and blanches the palatal part. Then I can come back and place the tip of the needle in the area just superior to the incisive foramen. Pressure anesthesia, it's going to infiltrate down to this area, and then I can go straight to the incisive foramen and anesthetize the nasopalatine nerve. Now, if you do that from the get-go, that patient is going to hate you and probably have a fear of dentists the rest of their life. So go through this area first from the facial and put a little pressure on it so that that local anesthesia infiltrates into the palate and blanches this part, and then you can work your way down to the incisive foramen and the nasopalatine nerve with that sit-nest plane. Then once you've anesthetized the area with the sit-nest plane, you can come back with the lidocaine 1 to 100,000 epinephrine and anesthetize the same area. And whenever you anesthetize the nasopalatine nerve, that's going to anesthetize this entire anterior region of the palate. To get the entire palatal tissue anesthetized, we've got to anesthetize the greater palatine foramen and the anterior palatine nerve. Put the topical anesthetic and then spray the benzocaine on those areas. And then you're going to take the end of your mirror and apply pressure anesthesia for about 10 to 15 seconds. And then you're going to slide the 30 gauge needle along the mirror handle and gently go into that tissue and just tap the end of the syringe. And the pressure anesthesia will anesthetize it initially, and then you can slowly apply the sit-nest plane to anesthetize the anterior palatine nerve coming out of the greater palatine foramen. Just watch that tissue blanch. Just pressure, not dire pressure, but just firm pressure. And then we've done the same thing here. We sprayed it with the Hurricane topical spray and applied the topical anesthetic. And then we're putting the mirror handle right over the greater palatine foramen and applying pressure for about 10 to 15 seconds. Then sliding the bevel of the needle along that mirror handle gently under the tissue, just barely under the tissue, and applying pressure, and you'll watch the tissue blanch. Then you can remove your mirror handle and go ahead and anesthetize it. The key is just slow, gentle, firm pressure, and you'll see that anesthetize. Now I'm coming back with the lidocaine in all those areas. But anesthetize first with the sit-nest plane because it's pH neutral and it doesn't sting. So that's how to apply palatal anesthesia relatively painlessly and profoundly. That's Dental Minute. These techniques work, and they work every time.
I know you want to take your practice to the top tier. Subscribe to dentistrymasterclasses.com for an organized library of all the Dental Minute videos, plus many complete comprehensive cases and many very important articles that you cannot get anywhere else. New cases are added weekly, only $20 a month. Subscribe now.